Hi, how are you? I'm Jason. I'll be your nurse today. I'll also be assisting Dr. Tuck with the surgery. He asked me to come in here and explain the surgery as well as answer any questions that you may have. As you know, we found a basal cell carcinoma on the anterior side, inferior to your eye but superior to your lip, in the middle of your zygomatic bone, uh, on your left side, which is a cancer cell found in the outermost layer of your epidermis or your skin. Basal cell carcinoma occurs when the outermost layer is exposed to too much ultraviolet rays from the sun. The radiation from the UV changes your DNA, causing the skin cells to overproduce, resulting in a carcinoma cell. The surgery Dr. Tuck will be performing is a type of chemosurgery called Mohs surgery. Basically, what happens is they'll mark your skin, like where the area where we're gonna remove the carcinoma cell, and numb you up with an anesthetic. Once that's done, they'll take you in, slice a thin layer off the carcinoma cell with a with a with a scalpel, and then take that thin layer back for a biopsy. We'll wrap you up and then bring you out to the waiting area, and then while that's going on, they'll take the biopsy back to the skin cell. They'll take a look at it and kind of make like a little map about it, like to determine whether or not this carcinoma is going to be superficial or it's going to be deep, and like how far it goes. And once that's done, we'll bring you back in, and we'll continue the process, taking it off layer by layer, and then continuing to check and see the progress of it. And once this is all done, and the tests show that there are no more carcinoma cells within the area, then we'll take you back and we'll fix the damage that was done during the surgery. Now this, depending upon like how deep the tissue goes, then we may have to do an autograft, which is basically just taking a thin layer of scanning and putting it over the abrasion that we've created. Now, once that's done, I'll go over with you the best way to take care of your wound and keep it from scarring before we send you home. Now, I cannot stress this enough. You have to take care of this. Like, this is the best way to protect you against scarring. Like, we're gonna do everything we can during the surgery to prevent, to make sure that you don't scar. But your best chance is taking care of this wound. And then one last thing I have to do before I answer any questions for you is I have to schedule a follow-up to remove stitches and check on your healing process. So according to our books, it looks like February the 14th is going to be the first opening now. So how does that work for you?